The FDA has given the green light to a less invasive test now for the coronavirus. Rutgers University researchers had developed the first saliva-based test, which could also reduce the risk of infection for healthcare workers. Dr. Devi joins us now. She's the director of Metropolis Pain Medicine and author of Coronavirus Made Simple. Dr. Devi, always good to catch up with you. Thanks for being here this morning. How big of a deal is this that the FDA has now approved this saliva-based test?
Well, I think it's a very positive development for a couple of reasons. So right now we're relying on nasal swabs, right? So a healthcare provider, usually a nurse on the front lines, has to come really close to the patient to be able to get that swab, to get that test. And in order to do that, he or she has to have a lot of protective equipment on, like gowns, gloves, the mask, the whole works. And so before they can test the next patient, they have to switch a lot of that stuff out, which means, we've been seeing shortages in that protective equipment, and that has caused problems in terms of the healthcare system's ability to test patients. So now with this type of test, what people can do is basically take the tube, spit into it a few times, and then hand the tube back to the nurse or to the doctor who's testing them. So that means because of this additional distance, they don't have to change their outfits as much, and it's much easier to actually get the test done and to be able to do it on a larger scale.
The FDA commissioner, obviously having the FDA just approve this, joined Fox News earlier this morning, and he said this is a big development. Here's the commissioner.
You can use saliva rather than the swab in the nose. It's more comfortable for the patient. Obviously, can be repeated multiple times. And it's actually safer for the healthcare provider. This is not an at-home test. This still has to be performed with a provider, but it does provide great advantages moving forward.
And this is Andrew Brooks, Dr. Devi. He's the chief operating officer at the lab at Rutgers that came up with this game-changing test. He says saliva testing will help with the global shortage of swabs for sampling and increased testing of patients. It will not require healthcare professionals, as you mentioned, to be put at risk. Saliva testing will also be important for people who are in quarantine because they don't know how long it will be until they are no longer infectious. And that is important and leads into my next question, Dr. Devi. What are we learning now? Because there seems to be mixed messages on this about whether or not we can get the virus again. If somebody had tested positive for it, symptoms or no symptoms, can they get it again?
Well, there's a lot of unknown here. So these reports are coming through the World Health Organization that sometimes people test positive for the coronavirus, then they test negative, and then they test positive again. So the worst case scenario is that somebody's getting reinfected with the virus or that it's getting reactivated. But I personally think there could be other possibilities also. So for example, let's say somebody had absolutely no symptoms and they test negative for antibodies, meaning that they're not able to fight the virus. The most logical conclusion is that they never had the virus in the first place. So if they had a positive test, let's say maybe they were exposed to the virus, they were in close contact with someone, and they happened to get a test, it's possible that that was a false positive. So early on when this virus came out, there were a variety of tests that were being performed, and there were questions about the accuracy of these tests across the world. So I think that has to be looked at a little bit more, like what type of test did this person have? Could there have been a false positive for the virus? Sometimes this happens also. Let's say that someone is testing positive for the virus and it's a true positive, but they didn't have any symptoms. Right now, we don't know if that's because the virus is so mild in some people or if it's because they figured out a different way besides antibodies to be able to fight that virus. So I'll just give an example so people can understand. Let's say that, if I'm walking on the street and I get mugged, I can try to fight that person, scream for help, all kinds of things. And, that would be one way of kind of escaping. Another way would be if the police came to my rescue. So in the example, let's say that I'm an airway cell or a lung cell and I'm trying to fight a virus. That's one way I could fight it. Or if the police came, that's kind of the idea of antibodies.